All right, let's talk about it, the NCLEX. For so many of you nursing students, it feels like this huge final summit after a long, grueling climb. Well, today, we're going to hand you the map and the compass. This is your essential expedition guide to make sure you get to the top. We're not just hoping you'll pass, we want you to walk in there knowing you've got this.
So, are you facing the NCLEX? If you're feeling overwhelmed, that is totally 100% normal. It's this massive milestone, right? And the amount of stuff you have to know, yeah, it can seriously feel like you're just standing at the bottom of a mountain, looking up, with absolutely no idea where the path even starts. But that's exactly where we come in. Think of this explainer as your map. We're going to give you the route. We'll break down this whole journey into clear, totally manageable steps. The goal? To get you prepping with purpose and, most importantly, with confidence. Okay, let's get into it. Section 1. Start at the source. Any good expedition needs an official map, right? Not just some doodle somebody drew from memory. And for the NCLEX, that means we have to go straight to the people who actually make the test. And here it is. This is probably the single most important thing you need to know. The NCSBN, that's the National Council of State Boards of Nursing, they're the ones who write the NCLEX. And their test plan? It's not a suggestion, it's not a nice to have. It is the official blueprint. It literally tells you what's on the exam. For example, you'll see a massive category called Safe and Effective Care, and a huge chunk of that is Safety and Infection Control. Ding, ding, ding! That's your first big clue about where you should be spending your study time. So how do you actually use this map? It's super simple. Step 1, just go to ncsbn.org and download it. Step 2, look for those core client needs categories. You're going to see right away that safety and infection control could be like up to 16% of your entire exam. So think about it. If you're a little shaky on, say, fire safety, the RACE acronym, or maybe the exact order for putting on and taking off PPE, well, this blueprint is screaming at you that that is a high-yield area. Focus there first. All right, you've got your map. Now it's time to gear up for the climb. Section 2 is all about your practice question arsenal. And let me tell you, for the NCLEX, there is no piece of gear more important than a ton of practice questions. Okay, so when it comes to practice questions, you've basically got two paths. On one hand, you've got free resources. And hey, these are great for just getting started, getting some reps in. But, and this is a big but, the real learning, the deep stuff, happens with paid question banks or Q banks like UWorld or Garcher. And you might be asking, why? It's all about the rationales. They don't just say C is correct, they break down why C is correct, and, this is the crucial part, why A, B, and D are wrong. That's the feedback loop that builds your clinical judgment. And please, whatever you do, do not underestimate the sheer number of questions you need to do. I love this quote from someone who just passed. They posted it on Reddit. They said, "The person who says they did 2,000 plus questions is not exaggerating." And that just hits the nail on the head. It's not about memorizing 2,000 answers. No way. It's about training your brain to see the patterns, to build up that mental stamina you're going to need on exam day. Okay, map? Check. Gear? Check. Now, let's talk about the expert guides, the people who can get you through the really tricky parts of this climb. Section 3, learning from the guides, your top video hubs. First on the list is Registered Nurse RN. Seriously, think of this channel as your in-depth clinical lecture. If you need someone to slowly, clearly walk you through something complicated, I'm talking pathophysiology, skills, you name it, this is where you go for that crystal clear explanation. Then you've got Simple Nursing, which is a totally different vibe. These guys are the absolute masters of mnemonics and catchy songs. If you're trying to cram pharmacology or remember something kind of random but important like bioterrorism agents, their little songs and cartoons will make that information stick in your head when nothing else will. It's kind of crazy how well it works. And what about when you just have like 10 minutes and want a quick review? That's where Level Up RN comes in. Their videos are basically like watching someone go through a deck of really good flashcards. They're short, they're punchy, and they're perfect for reinforcing facts you already know. Great for a quick review session. Okay, let's be real. Nobody conquers a mountain all by themselves. Every good expedition has a base camp. A place to rest, get advice, and find some encouragement. For your NCLEX journey, that base camp is online. Welcome to Section 4, the base camp. Tips, tricks, and community. So where do you find these people? Well, these are your big hubs. Allnurses.com has been around forever. You can search their forums, and I guarantee whatever question you have, someone has asked and answered it before.
Then there's Reddit. The subreddit r/pass NCLEX is amazing for seeing real-time success stories and what's working for people right now. And if you boil down all the advice from those communities, you pretty much get this chart. And what's so interesting here is look, yeah, mastering the actual content is the biggest piece at 40%, but doing practice questions consistently is right behind it at 30%. That tells you everything. The NCLX isn't just a test of what you know, it's a test of how you apply what you know. And please, please look at that little 10% slice for mental health and rest. Don't ignore it. Burnout is real and it will end your expedition real fast. Oh, and here's a quick little pro tip from the Basecamp crew. Do not sleep on the free cheat sheets out there. Seriously, sites like Straight A Nursing Student or nursing.com have these amazing condensed study guides. They're perfect for a quick look over or just to have saved on your phone. Okay, deep breath. We've made it to the final section. This is the summit push. This is all about what you do in those last few days to make sure you walk into that testing center at your absolute best. Let's talk about your final ascent strategy. Here it is, your checklist for the final week. Rule number 1, stop cramming. This week is for review, not learning new stuff. Just taper off. Do maybe one light practice quiz a day just to keep your mind sharp, but that's it. No more 8-hour study sessions. Figure out exactly how you're getting to the testing center, what you're going to wear, eliminate all that last-minute stress. And here's the most important rule of all. The day before the exam, you do absolutely no studying. Nothing. Your brain needs to rest. You have to trust all the work you've already done. Because at the end of the day, that's what this is all about. When you have the right plan, the right tools, and the right strategy, this thing that feels like an intimidating mountain, it stops being a challenge to be afraid of, and it becomes an achievement that you are ready to earn.
So, we've laid out the map for you. Now the question is, what's the very first tool you're going to add to your pack? Are you going to go download that NCSBN blueprint right now? Are you going to sign up for a QBank tonight? Or maybe subscribe to one of those YouTube channels? Make a decision. Take that first step. Your expedition starts right now.